in OT, the patient position is important. I mean, positioning is a very concern because of the obesity. If improperly positioned, then physiologic derangement like venous return may be hampered, nerve or tissue damage may happen. Rhabdomyolysis is a big concern and injury related to fall, patient himself, or limb drop can happen to injury or fracture. In supine or head down position, the FRC is decreased and venous return is increased. So there will be a rapid desaturation and increased pulmonary shunt, edema of the for long surgery, edema of the head and neck, and hypoventilation when spontaneous. For a head-up position that improves respiratory function, useful during pre-oxygenation, mask ventilation, and laryngoscopy. But the patient may slide down and arm may get traction from the fixation to the sideboards. Prone, if properly positioned, improve respiratory function, FRC, compliance also improved and oxygenation improved. As in COVID and ARDS patient, these days, prone positioning is advocated. Lateral decubitus removes the weight of the abdomen from diaphragm, so it also increases the diameter of the pharynx, so giving a relief to airway. But there may be a compression in the axillary, so large rolls to be placed under the chest, so that the arm is not under pressure, the brachial plexus is not under pressure. Head need to be supported in a neutral position. There may be traction to the cervical nerve roots. Also in the hip, because of the weight, you need to put some flat gels there. Lithotomy, especially in these days, laparoscopic hysterectomy are being done in our hospital. We're doing lithotomy position with steep head down. So that decreases lung volume. There may be some hypoxia and hypoventilation, and leg positioning and padding to prevent nerve injury and compartment syndromes. And overall, the beds need to be a proper strength and size, and all the accessories need to be strong and spacious. The special things need to be taken care. This is the ramp position illustration. Ramp is in picture B, you see the patient is in upward sloping, so you can call it a ramp, but ramp means rapid airway management position also. So this is the intubation position when the tragus and inlet of the sternum is horizontal. You have to put multiple bed sheet, or we have a kind of triangular gel kind of thing that we place under the shoulder to make the head like this. This is the standard intubating position for obese patient.